in some women can cause fluid retention, which can lead to headaches, bloating, depression, anxiety, food cravings, and a myriad of symptoms. They're from mild to severe degree, and in some women there are no symptoms at all.
Now, severe degree, you talk in your pamphlet all the way to suicidal depression. Have you run across that?
Yes, unfortunately I've seen it in my practice, suicidal depression.
Now, does the Medical Association as a whole recognize this as a legitimate condition now?
I do think it's recognized as a legitimate condition, but not knowing exactly what the cause of PMS is, it's led a lot of people to wait to find a cause before then they introduce treatment.
Yes.
Unfortunately, that may take some time, and this is a syndrome that does exist for a lot of women. It in some cases incapacitates them, but in a lot of cases it's mild and just reduces their quality of life. So it's important to recognize it and treat it.
It's a matter of degrees, then.
It's a matter of degree.
Now, you call it a condition, a syndrome. The American Psychiatric Association wanted to have it listed as a mental illness.
They tried to do that. Again, a way of trying to box it in a category and then brush it aside, or then have a legitimate treatment for it. If you call it a psychiatric condition, then you just use psychiatric drugs for it. But that's not going to change the picture. What we're finding is if women can know their cycles, if they can get used to the pattern of their low times, chart it down, take it into the doctor, then the two people can decide what's to be done. And there are enough articles being written on PMS treatment to do something about it in terms of diet, in terms of certain vitamins that are useful for decreasing the fluid retention, all the way up to using progesterone suppositories for the treatment.
So it's definitely treatable.
Yes.
And is the first step is to recognize it as a legitimate condition.
That's right. You could go to your doctor one time, 1 year, and not be in your PMS and not even mention it. You go another year and you're right in the middle of it and you feel sort of...
and it comes up and... Now, I'm really curious about something. There was a very recent case in London, Ontario, where a woman was given a suspended sentence and probation after stabbing her husband. Her main defense was PMS. And I know that there have been acquittals in the United States and in Britain. Now, if the legal system recognizes this as something in which a woman may not be held responsible for her actions, doesn't this give credence to the old line about, well, you can't put women in top management or top political positions because certain women are crazy? Where do we stand?
Okay, there are a lot of things on that. As a woman, I don't like that because it implies we're at the mercy of our hormones. As a doctor, I don't like it because it is sensationalism.
Yes.
The judge who I didn't read the whole testimony, but I'm sure that was an individual case of circumstances in that one individual, and it's so rare. Women don't get to positions of authority or power or any high stress if they have PMS. Unfortunately, they're already weeded out.
So it's self-limiting.
Yes, yes. And again, I must stress that it's a treatable condition. It's usually mild, but in the severe forms, the fact that women haven't been treated, there are no resources. You can't ask to be admitted to a hospital to prevent you having a suicidal attack in your PMS. Even though a woman can document exactly when she's going to be ill, there's no hospital that'll take you.
So should a woman just see her own doctor or see somebody who deals specifically with this?
Well, unfortunately, there aren't clinics, there aren't places where women can go in general, so I think family doctors have to get involved. I've written a number of articles myself, and Family Medicine April '86 has the medical management of PMS, which is a very good article and very practical. Patients can look it up and bring it to their doctors, but GPs have to get involved.
Okay. Thank you so much for joining us, Dr. Dean.
Thank you, Sherry.
Over to you, John.